Last Friday, 21st of February, was World Care Day, a day dedicated to amplifying the voices of children and young people currently in foster care or who have had a foster care experience. Today, we are joined by Deb Sobaris, CEO of the Centre for Excellence in Child and Family Welfare, to discuss healthcare needs for young people in out-of-home care. Welcome to 3CR, Deb.
Thank you so much. I hope that's not bouncing around. Sorry.
That's perfect. Thank you so much for joining us. Can you start by introducing the work of the Centre for Excellence in Child and Family Welfare to listeners who might not be familiar with it?
Of course. Thank you so much for having me on. So the centre is the peak body representing children and families in Victoria and Tasmania, and the organisations that work with them every day. We run a range of programs, including Fostering Connections, because I think we've spoken to you about this before, which is the statewide recruitment service for new carers across this great state. And I'll just say, if your listeners are listening, which they all will be this morning, all kinds of kids need all kinds of carers. So we're pretty keen to make sure that we've got enough foster carers here in Victoria.
It sounds like a really important job. And you've recently been speaking out and also making submissions to the government around healthcare. And what are some of the physical, mental and developmental health challenges that young people in out-of-home care face?
Like all young people these days, they all need medical, not all, but many need medical and educational support as part of their young life. And that's no different for young people who experience care. However, they don't always have an adult to advocate for them to get what they need. So our concern is that really young carers and even those carers that have left the system are really at a disadvantage compared to their peers. They often don't receive or can't get access to the health assessments and then can't access to get the right care they need at the right time. And when I talk about that, I mean educational supports as well as health supports. And this is a really urgent challenge, and it's been going on for many, many years. And so many, many young people in care talk to us about this as being the biggest barrier that they face. And it's really frustrating for them. It's frustrating anyway, isn't it, getting the right health care and the right educational care when you need it. For these young people, it's even tougher.
That's what I was going to say. It's hard enough for a lot of people. We're seeing in the news people who can't access a GP because there isn't, the bulk billing and those sorts of things. So I can imagine for young people who, as you say, can't advocate for themselves either and don't have the resources, it must be really difficult.
So with this group of people that have come together at a national level, they're called the National Foster Care Sustainability Group. They're auspiced by the National Children and Families Peak Body, so not me, I'm part of it, but not me, called Families Australia. And we want three things for kids in care. And we believe that the Commonwealth Government has more than enough remit and has all the levers to do this. So we want a gold card, a bit like the Veterans card, for young people who are and have been in care. And what that will mean is that they don't go to the back of the queue, that actually they go to the front of the queue. Now, most people would say, is that fair? Of course, somebody like me, who advocates for children, is going to say, well, these kids have fallen behind and they'll continue to fall behind. And so we want them to have just that little bit of an advantage. If they can't get the care they need in the public system, then our private system will kick in a way. So we really want to see that happen. And we're getting a good sounding, actually, from both the government and the opposition on this.
And it looks like you're asking also for a national consistent healthcare model. Can you tell us what that might look like?
Well, we know that if a child who's been in care gets a gold card, it means they can get the service they need anywhere in the country because there is a private system as well as a public system across the country. And it also means that if they need an assessment, a health assessment of a particular type, they will get that. Because a gold card represents something in the hearts and minds of Australians, particularly for veterans, And we would say that we actually want the same sentiment and the same level of action that veterans get with their cold card. And that's what we mean. We know we'll get consistency then in terms of treatment for children who've been in care or are in care. And as you imagine, for some children, young people and adults, they sometimes it's as simple as getting the dental treatment that they need that they've never been able to get access to. So we think there's a pretty exciting opportunity for an incoming federal government to equalise the access to health services for all young people that have been in care. We think it's a game changer, and it really shows care leavers that actually this country really cares about them because it's going to put them first.
And you've said that the goal is, to sort of equalise access to care, even within children and young people who are in out-of-home care. Are there particular differences that we need to be aware of in terms of access from different regions or different groups of people?
Yeah. So your listeners would know that it's very difficult in different parts of the country, but particularly different parts of Victoria, to get access to the healthcare that you need. And so, look, we're not saying that this would mean it would be an overnight success, but at the very least it would mean that whatever services were available, children who are and have been in care would be given some sort of priority. It is hard accessing these services anyway. And a gold card is a bit of a signifier of the fact that these children have had a tough time. And for them to be able to, I call them superpowers, for these children to exert their superpowers, because often they are the most resilient children I've ever seen, we need to make sure that they are set up for success and where possible get access to the services that they need. You did mention earlier it is hard to get into see a GP with bulk billing. This would be less of a problem because it would mean these children do get access.
And are there anything else that you're asking in terms of increased investment in this upcoming federal budget? Yeah.
So we're also asking for reducing financial pressure on current foster carers by raising the ATO tax-free threshold for foster carers to sort of ease financial pressures, enabling sort of higher allowances for those carers without the tax burden. So like many of us, foster carers are struggling with the cost of living crisis, and there are people that would ordinarily become foster carers that just can't afford it. So this raising of the tax threshold would mean that foster carers get just that little bit more money in their pocket to be able to buy the groceries and pay the bills for having those extra children in their home. So we think this is a no-brainer. If you're going to be a foster carer in this country, you should be given additional financial support, acknowledging what you're prepared to do for this nation. And the other thing that we're really interested in is more equitable leave for foster carers. We know that many carers have to take time off work to go and take kids to health treatments and to other appointments that they might need. So we want the government to consider maternity, paternity leave and extra leave for carers who decide to become foster carers in Australia. And I have to say, in talking to lots of MPs up on the Hill, they're pretty interested in these three asks because actually this is where the Commonwealth can make a really big difference in this country. We are losing foster carers in Australia, that people are struggling to become foster carers. We think these three things could make a world of difference.
Mm. And we are running out of time, Deb, but just before you go, is there anywhere you would direct people listening who either may be in out-of-home care themselves or involved in providing foster care, anywhere they should go for more information or for help with finances or accessing healthcare needs?
Look, what I would say is for kids who are currently in care, please talk to your workers. Please talk to your workers. If you're worried about your health or you need help right now, do not hesitate, but urgently talk to your worker. Most kids have a worker who are in care. Please do that. I think that there are some very, very, very supportive GPs, so please go and talk to your GP if you're really concerned. And if you're really not getting what you need, head off to your local casualty department because, I was there the other day and there were lots of people there who were trying to get access to the system and that was the only way that they could do that. But they can always jump on our website or call us at the centre. You just need to look at the Centre for Excellence in Child and Family Welfare. It will come up in your Google search and there'll be loads of numbers there in order for you to give us a call. Call our reception. And if you are needing to talk about these issues, talk to us about your experience, or you need somebody from our organisation to point you in the right direction, we're always there.
Thank you so much, and thanks for joining us this morning.
No problem at all. Thank you.